this study really adds to our knowledge about how COVID-19 affects pregnant individuals. We know from prior studies that pregnant people are at increased risk for things like ICU admission and death and needing a ventilator when they have COVID, but this really extends that work to look at increased risk with other pregnancy complications. So really having progression to really serious disease in the cases of developing high blood pressure during pregnancy or having a postpartum hemorrhage during pregnancy or having some other infection that's unrelated to SARS-CoV-2 during pregnancy. Our primary finding is really related to maternal serious morbidity and mortality. And what we found is that pregnant people who have a positive SARS-CoV-2 test are at higher risk for serious morbidity or serious complications when they develop some pretty common complications of pregnancy, like high blood pressure, postpartum hemorrhage, and other infections. We also found that babies are at increased risk for preterm birth and NICU admission. But fortunately, it appears that all of these risks are really mostly among those who develop moderate, severe or critical COVID-19, and not those who have a mild or asymptomatic infection. So this study was a multi-center study of 17 hospitals across the United States who participate in the NICHD Maternal Fetal Medicine Units Network. For this study, we had research staff who did detailed medical record abstraction on over 14,000 women and looked at their outcomes. About 2,300 of those had a positive SARS-CoV-2 test, and the remainder had not, and that was our control group that we compared them to. The big take-home message is to get vaccinated if you're pregnant or considering pregnancy. As I mentioned, we really did not see these increased risk from these obstetric complications in patients who had more mild or asymptomatic disease. And we know that vaccination is safe and effective in pregnancy, and that it helps prevent progression to more severe disease. So with vaccination, we would also hope that then the patients wouldn't have these complications that we saw in the study of the patients that had SARS-CoV-2. I think it was surprising that we did see these progression to serious morbidity. I think that we would normally like to see that we'd be able to curtail, patients progressing to more serious complications when they have things like high blood pressure and pregnancy. But on the other hand, we are in the middle of a pandemic. There's a lot of precautions that need to be taken, especially among patients who are positive for SARS-CoV-2 or have COVID-19. And so it was plausible that we would see progression to these more serious complications just because of delays in care or because of the disease itself. So we were hopeful that we wouldn't be seeing this, but unfortunately we did. We definitely did see that it put people at higher risk for progression of these common diseases in pregnancy. So for example, in the setting of development of high blood pressure in pregnancy, we would typically see that in 8 to 10% of pregnancies. But when patients had SARS-CoV-2, we saw a lot more progression of disease severity to the point of, damaging the kidneys or the liver, needing IV medications to try to control blood pressures. The same thing with things like postpartum hemorrhage. The outcomes we were looking at were not just the fact that somebody had a postpartum hemorrhage, which is pretty common in pregnancy. It was that then that hemorrhage progressed to the point where they needed surgical interventions and other things that wouldn't typically be done with these complications. And so it was really this progression of these common complications to much more serious consequences that we found in the study. It's hard to know because we don't have information about care pathways. When we were designing the study, we were concerned that in the setting of the pandemic that potentially patients would delay coming in for care. Certainly early in the pandemic, we saw that for a number of a number of different disease processes. We also worried that perhaps there wouldn't be availability at doctors' offices and hospitals. And so maybe they would not be able to come in person, or we wouldn't be able to check their blood pressure and they'd be having a telehealth visit. And so perhaps there'd be a delay in that way that would result in progression. And then in the hospital, definitely healthcare providers need to do things like put on personal protective equipment before they're able to intervene, and potentially there'd be some disease progression there. And then certainly from the virus itself, we know that the virus has effects on the placenta. That could certainly increase risk of people developing more severe hypertension in pregnancy or high blood pressure in pregnancy. And also the need for preterm delivery if they develop higher severity of these complications. And so it's likely a combination of a variety of factors that resulted in this increased risk.